Tonight on Doctor's Diaries.
See up here how it's pretty narrow in here? It's thick here, gets a little narrow, then it gets thicker again.
I feel good. If it wasn't for this pain, I'd be great.
Oh my God. The boss just called and he wants a bed. There are 5 other patients that need that bed. Dude, it's all breaking down. Mayday, mayday, mayday.
In situations where people are at their worst, they're also at their best many times. I ask myself, how can they still believe? And they do, in such horrible situations.
Born just 2 hours ago and a month premature, twins Sean and Samantha Sura are rushed to Westchester Medical Center in critical condition. They both have difficulty breathing and are being transported to the neonatal intensive care unit, and every second counts.
Come on, elevator. His eyes open? That's the first time I've seen his eyes open the whole time.
The twins' condition is so severe that they required more advanced medical care than the hospital in which they were born could provide.
Baby's here. 2 of them.
Their mother is still recovering from the birth and couldn't travel with them. Sean is having difficulty breathing because of his underdeveloped lungs. In addition, he cannot maintain a normal body temperature. His sister Samantha is in even greater danger. Not only is she having difficulty breathing and maintaining body temperature, but she weighs only 4 pounds, which puts her at high risk for further complications.
Samantha is the one who's giving us all the problems.
Okay.
Doctors can only hope for the best, but prepare for the worst. Ethan Hansen, a medical student who severely dislocated his shoulder when he was thrown off his bicycle, is prepped for surgery by Dr. Dan Zelezny, an attending orthopedic surgeon at Westchester Medical Center.
I can actually almost prop his shoulder out this way.
Ethan needed surgery because he was constantly dislocating his shoulder with everyday activities. Even the tossing of a frisbee caused severe and sudden excruciating pain.
And a young guy who's pretty athletic and pretty active, you want to do something to stabilize the shoulder and prevent it from dislocating again, because more than likely it will come out again. Because each time it dislocates, it stretches out the structures and makes it looser with each dislocation. So it becomes easier to put back in, but it also becomes easier for it to pop out every time. So we got to do something to tighten it up.
Dr. Zelezny opts for arthroscopic surgery rather than cutting open Ethan's shoulder completely, which could both damage the muscle and lead to a longer recovery.
Alrighty.
The state-of-the-art microscopic surgery will help Ethan heal much faster.
We have these little, soda straw dimension diameter incisions, and everything is done inside. You don't violate the muscle and the skin and the fat and everything that is between the skin and the joint. So from the patient's standpoint, cosmetically it looks better, and conceivably, theoretically, the rehabilitation is facilitated and more rapid. All right, so it's pretty clean. Looks pretty good. So we know what his pathology is, and this is the rest of his rotator cuff up here, which looks nice.
Though this surgery is much easier on the patient, the techniques are extremely complex and difficult for a surgeon to master.
You definitely have to have some kind of three-dimensional aptitude, and it's called triangulation, to be able to look at a screen up there and have your hands doing something down here, and it's not directly tactile. You're on these instruments which are like a foot away from your hands, and you have to maneuver them. So it takes a lot of practice, especially getting oriented with you have to have knowledge of the anatomy to know where you are, and how things should come together and how things should look. The shoulder joint's like a golf ball on a golf tee, and the golf tee is the shoulder blade, the glenoid here, and then the humeral head, which is this thing up here, should be sitting in the center, but you can see here's the front lip of it, and his So like right now, his shoulder is just about dislocated, totally off. And this edge right here was stuck on this front edge right here, and that's why he got this big shark bite out of his humeral head. And that's why it'll probably happen again if he's active. This shoulder will dislocate again if he gets himself into the right position. This stuff, we're going to shrink this up, because this is that whole thing that with each dislocation, this tissue known as the capsule stretches out and becomes like an old sock that you don't like to wear anymore because it doesn't hold up around your calf, it falls down around your ankles. So what we'll do is this thermal shrinkage stuff, which tightens this up, and we'll see if it works just on a little sample piece right here. And you see it kind of cooks it like a piece of bacon frying in a pan, shrinks it up. And I love bacon. You see the difference between this white area here and this like pinker area there. That's the part I didn't touch. But you see how it comes right up? Come on, get in there.
Everything seems to be going fine until Dr. Zelezny gets into a little trouble.
I'm not used to this equipment at all.
She's staying, by the way, overnight. She's staying.
It's late afternoon, and Dr. Ben Udelman, a second-year resident at Westchester Medical Center, is just starting his shift.
I'm assigned to the surgical intensive care unit and cover the patients in this unit, of which there are 7, in the other surgical intensive care unit, of which there are 8, and then all the patients who are post-operative, who are in the recovery room either for a few hours or if they have to stay overnight because there's no intensive care unit beds and they can't go anywhere. No, you have to take, this is the pill that's going to keep you from bleeding to death. This is important.
Keeping track of all his patients requires organizational as well as medical skills, and sometimes even skills they never teach you in medical school.
This is the pill we talked to your daughter about. Wait a minute, hold on, listen to me. This is the pill. You know, you have a hole that's bleeding from your esophagus and your stomach. This is the pill that keeps you from bleeding. Okay?
There's a lot of social politics associated with being sick. Patients, no matter how sick they are, they want to be in command of their life. It's just astounding at times to have someone who is being supported with chemically, who's being supported with a ventilator, who is lying in a bed, and who is shaking their finger at you. They can't speak per se. They're shaking their finger at you and they're writing stuff down like, turn the light off and close the door when you leave, and you're like, you know, and you have to realize that that makes sense.
No, seriously, sir, this is extremely important, okay? Just this one.
No, take it away, please.
We're gonna have to put a tube in your nose, okay?
Take it away.
I'm gonna have to put a tube in your nose and put this pill down it, all right? But that does happen sometimes. You run into people who really, you know, want a tremendous amount of things explained to them, and they're just very distrusting and they're very paranoid, and it creates a lot of problems because, you know, we go through all these years of training and we work very hard to figure out what these patients need, and then we go and tell them what they need, and then, you know, then they need sometimes more explanation. That's not to say that they don't deserve it. It's just to say that sometimes, even when you explain it sort of in the standard average way that we explain it to everybody, they're still uncomfortable, or they're scared, or they're distrustful. Hey, how are you?
Tonight, the intensive care unit is overflowing with patients, and Dr. Udelman must come up with a plan that can accommodate them all.
Right now, I have to orchestrate the movement of people in and out of the beds. Sometimes you get people that are so sick you can't move them around. So once you set up a situation where you have somebody who's sick who's probably going to be in that bed for a long time, you want to put them in the place where they need to be and not bring them in and then move them again and move them again. Who has a urology patient? Urology? And then you get a call from the big guy, and he says, I got a really sick person in another hospital that really needs to be here now. Well, then all these like 10 people, you have to decide exactly where to put that person, and there's like a lot of stuff associated with this. And I'm just a kid. I'm not supposed to be making these decisions. So I need to call someone who's a little bit higher up in the ranking system to help me to decide.
Back in the OR at Westchester Medical Center, Dr. Zelezny continues to struggle with the arthroscopic tools on Ethan's dislocated shoulder.
The most difficult part of the procedure was getting used to the particular equipment that this institution has. There are so many different types of anchors, suture sets, arthroscopic tools that they all have little nuances that are different, and they're so subtle that they seem insignificant, but when you're actually in there using them, it makes a big difference.
Dr. Zelezny asks Dr. Howard Lux to assist him in the procedure.
You come in, please. Come on. Come on in, will you? I need a hand in here. Come on, man. I need your expertise, the experience. That's when Dr. Lux was extremely helpful. When he came in, he's just made things go so much more smoothly.
Don't squeeze it like that.
Okay, I didn't mean to.
So this is the one that goes in.
And it's also really important to have another skilled pair of hands who knows what you're trying to do, so he can position a retractor the appropriate way or do something that'll just help facilitate the surgery. It's hard when you're just on your own or with someone who doesn't have the experience to know what you want to do.
Once you get the hang of this thing, it's very easy, actually.
Dr. Lux helps hold Ethan's arm so Dr. Zelezny can put anchors in the tissue and pull it tighter.
Over. Good. Bounce it 3 times. 1, 2, 3.
Well, you got to be good at the Boy Scout knots here, because you're tying everything was done through the scope. So the sutures you bring outside while they're attached to the anchor. You tie your knot outside, and then you have to push the knot down through this cannula, down and into the shoulder joint, and expect it to get down there and cinch it tightly.
Cool. Another one. Last one. Oh. No? Not too happy.
Oh, I thought you meant next thing. Yeah, isn't that enough?
Okay. Scissor. Leave good. Yep, good. Boom. Beauteous.
For more information, log on to our website.
That one came out pretty good.
Why shouldn't it?
Wouldn't have if you weren't here.
Okay.
Yep.
You cool?
Yeah.
This is easy.
Yeah, totally cool. Thanks, Howard. It's tough. You need another pair of hands. Thank God Howard came in, because, I'm barely new to this equipment. I need Howard to hold and direct while I'm figuring out what was going on in there.
Ethan's surgery is complete, but getting a full range of motion back in his arm is going to require lots of rehabilitation and hard work.
Well done. I get stressed for all the procedures that I do to some degree, because I don't want to hurt anyone, and I don't want to do a bad job on anyone. And, people come to you because they want to get better. And if you don't make them better, then, what are you doing?
"45 minutes after the twins arrived at Westchester Medical Center. They are still in the neonatal intensive care unit.
I really thought we had serious problems. I didn't really know what to do. I saw a lot more people attending to them, and no panic, but I just saw a lot more things going on, and I began to worry, of course. I didn't know what was really going on, but my pediatrician took me aside and started telling me all the possibilities, and he recommended Westchester.
Dr. Lance Parton will be overseeing Sean and Samantha Sura's stay at Westchester Medical Center while they are in the NICU.
But these are a couple of premature babies, born about a month premature. They basically needed some extra respiratory support. Samantha here is still on about 25% oxygen by nasal cannula.
Even though Sean is in a controlled environment, he's still having trouble. Despite bundling and double wrapping, his underdeveloped skin cannot maintain body temperature.
I had been suffering from chest pains and back pains for a month and a half, and my GP sent me to a neurologist, and in 2 days he had me admitted into a hospital.
Sandra Mount arrives at Westchester Medical Center wearing her wig. She's used to it by now since she's received lots of chemotherapy. Sandra is suffering from multiple myeloma, a cancer of the blood that also attacks bones, organs, and the immune system.
Any other past medical history you can think of?
I had an infection behind my eyeball. I was in the hospital for that.
The treatment she's about to get is her last hope. She's come here for a stem cell transplant, a radical procedure designed to help her own body make cancer-free blood. As in all transplants, the difficulty is in finding a compatible donor. But Sandra is extremely lucky. She has an identical twin sister.
The oncologists were elated. That's so rare. And obviously the best match you could have.
Sandra's twin sister Linda is a perfect match for the blood transfusion. Her cells are cancer-free and she has the exact blood type.
And she called and said she had multiple myeloma, and my first reaction was, what is that? I never really particularly heard of that. And when she mentioned it's akin to leukemia and that sort of thing, actually, one of my first thoughts was, my God, I can give her marrow.
Dr. Tassif Ahmed is the chief of oncology at Westchester Medical Center. He will be overseeing Sandra's cancer treatment and the critical stem cell blood transfusion she desperately needs.
I was telling Linda that for a few days, you're not going to like me because you're going to be sick. You're not going to like me because I'm making you sick with all the things that I'm doing to you.
You're going to make me better.
Exactly. That's what counts.
That's what you're doing. I mean, I know I have to go through some of these things.
Yeah.
To get better, I'm going to be better.
You will be all better.
We're going to beat on your chest some more and try and get this crap out of your lungs.
Dr. Udelman must constantly make rounds on the more than 20 patients he oversees in the surgical intensive care unit.
Your white count's coming down. Everything else is looking good, except you're not breathing so good. So we're going to just work on that for a few hours. We're not going to wait all day, but we're going to do our best, okay? Try and keep that tube out as best we can. If we can't, we can't, all right? Hang in there. A lot of the sick people in the hospital are surgical patients, and we have to take care of them all the time. So it's all of the events that could lead up to someone needing a surgery, all the complications of a surgery, and everything associated with healing, recovering from a surgery, and all the complications associated with all the complications. That's what we have to know in order to do this job. Okay, I'll do it now. Bye. Okay.
Dr. Udelman is still dealing with an overflow of patients in the intensive care unit.
Dude, it's all breaking down. Mayday, mayday, mayday. Well, do these bounce? These phones bounce, don't they? I don't know what the hell's going on in my family's life. Oh my God. The boss just called and he wants a bed to transfer a patient. I love my job. I love my job. I love my job. There are 5 other patients that need that bed. What in the world is going on? Oh, actually, hold on. And I'm supposed to make the decision, which I'm absolutely not going to make. Where's my sister? Okay, well, I am just getting slammed here. Like, you have no idea. Oh my God. I need to get that phone. Hold on. Could you hold this? Hello? Elka. Oh, Jesus. No, no, I know you were. I apologize. We have a big bed problem. Are you close by me? I'm in D.
Dan, who's on this phone?
Oh, yeah, okay, great. Bye.
Nobody.
Okay, this is getting really oh, this is my life! Dr. Turk, I'm sorry, I was away from the phone. What's the problem? No, I was not. Can you please call, find out, and get right back to me? Thank you, bye. Hi. What's going on, Mom?
Before Sandra Mount can get her stem cell transplant, she must first receive 1 week of intense radiation and chemotherapy. Then, after just 1 day's rest, she'll get the transplant that may or may not save her life.
I know that some of the treatment is going to be difficult and not pleasant, but it's worth it because I can be healed.
The radiation treatment Sandra must go through will kill the cancer cells, but could ravage her internal organs in the process. Doctors mark an outline on Sandra's body, showing the areas where her lungs must be protected from the high doses of radiation throughout her treatment.
I pray before I go. I pray the Liturgy of the Hours, and I pray a rosary, and while I'm down there, a lot of times I'm praying the Divine Chaplet.
Many people would say, God, why did you do this to me? She just looks at it as, well, this is something I'm suffering through, and I'm going to get through it because you're here with me. Her faith is just incredible. Never falters. What I'm doing now is the stem cell separation in the machine that separates the stem cells, and it goes, the blood flows from one arm through the machine and back into my other arm and keeps the stem cells separated.
Once Linda's blood is collected and the cells are separated by the machine, it'll be sent to a laboratory where her blood is frozen until Sandra's transplant date.
Her faith and my faith is really so well grounded. We have a very positive reaction and thought about, well, you get through this. God's with you step by step, day by day.
Father James Stewart is one of many priests who counsel Westchester Medical Center patients.
So why don't we begin, Sandra? In the name of the Father, and of the Son, and of the Holy Spirit. Amen. I met Sandra, I think it was the second day after admission. It was quite clear her faith was a real central, it wasn't just an adjunct, it was really there. Our Father, who art in heaven, hallowed be thy name, thy kingdom come.
Priests and religious people have been very important in my life for years, and my parish is very important to me. Prayer is very important to me.
Sandra, I pray that the blessing of our merciful God, the Father, the Son, and the Holy Spirit be with you and remain with you forever. Amen. Because what struck me so much was when she said something along the lines, if I remember correctly, whether I live or die, it's not in my hands. And I'm all right with that. I just want the Eucharist. I want to receive communion because I need that reminder of that presence. I was floored. Tremendous amount of faith. And very real, gutsy stuff. You know, this wasn't magic, you know, save me from this hour kind of thing. This was, I'm here, and we're going to do this. And I don't know how it's going to end, but I trust that God will take care of me.
I teach kindergarten. I'm famous for my hugs and that I'll stop and listen to them, and you know, it doesn't mean that they think they can walk all over me either, though. I'm very strong in making sure they behave the way they're supposed to behave, but in a nice way. And the whole school prays for me all the time. I don't get scared about getting healed, because I know I'm going to be healed.
Several days after premature twins Sean and Samantha Sura arrived at Westchester Medical Center, their parents, Michael and Linda, finally get a chance to hold them. Samantha has come off her oxygen and is able to breathe on her own, but both twins still need to get their body temperatures to a safe level before they can be released from the hospital.
They just moved Samantha in, and they took her off of oxygen today, which was great. They weaned her down every day, and they able to bring her in next to her brother for the first time. But my wife wasn't able to really be with them. You know, she saw them actually when they were packed up, both in an incubator together, and you know, that was the only thing, except 2 Polaroids that we had. The nurses took, and we couldn't, she couldn't, that was it.
No, I didn't get to hold them at all until I got here Sunday. I saw them for 2 minutes in the operating room, and then
gave me a quick
2
kiss
minutes when the medical team was right before they were gonna airlift them away.
You must have been kind of freaking out, huh?
It was a rough day.
Can I open this yet?
Oh,
Yeah.
boy.
I'd love to have them both home. Sean might get discharged earlier than Samantha, but today was a big step, so we'll see if she starts eating. It's still a possibility, but I tell you, at this point, I don't want to rush anything. Whatever happens, they got to be here. I know they're getting the best care. So whenever they get home, it'll just be a big party.
I was having some chest pains and not feeling right for the past 2 months, and a lot of palpitations.
Marjorie Sheeran has been admitted to Westchester Medical Center to see if she needs an angioplasty, a procedure that expands clogged arteries.
Have you gotten your tattoo yet?
Dr. Craig Munson will perform Marjorie's cardiac catheterization.
She's had a history of a heart attack about 12 years ago, 11 years ago, and at that time she presented and was referred down here, and we did a cardiac catheterization. At that time we found one of her arteries was narrowed as a result of that myocardial infarction, and she had an angioplasty done at that time. Back in '88, I think when we did her, that was before we had stents.
A stent is a stainless steel mesh tube that scaffolds the artery and holds it open permanently. Even though this is a common procedure, there are always risks involved. Outside the stressful environment of surgery, Dr. Zelezny finds his relaxation on ice.
You need to have, I think, some physical activity this is a totally different mindset. You know, you can go and watch television or go to the movies and I do plenty of those things, to just kind of lose yourself for an hour or two in some mindless television or film. You know, but physical activity is necessary, at least for me. You know, so playing hockey is something I love to do.
I call this my home rink in Stamford, Connecticut, because I've been playing here since I was really small. I broke my jaw right there when I was, I think, a senior in high school. And, you know, it's nice when we have a game back in this rink. Don Maloney told me he stopped the scrimmage once and he said I made a good check on somebody. I was like all happy for like months. It was a figure skater, but it didn't really matter. It's nice to be able to get out here every once in a while and still do something active. It's fun. My parents come and still see me play. Hey!
Okay.
He's number 5. Didn't I tell you?
Hey guys, let's go.
Bring it in, bring it in.
Jump on these guys. Let's tire these guys out. Let's just work our asses off.
Let's go. Let's have a great game, guys. A little fun. Blast on 3. 1, 2, 3. Blast!
See if I can last for more than one shift this week. Man on you, man on you! All through the years, I had to stop during residency. I didn't really play that much because it was just, you know, I was just too busy at the hospital working. But now, you know, I got a little bit more free time, and so I hooked up with this, you know, in this league, and good bunch of guys. We have some fun. Guys I know from the hospital too. So we'll get out there and see if we still know how to skate. It's nice to be able to think about something else other than, you know, the medicine all the time. It takes my mind off it, and it's a good, break a good sweat. It's a lot of fun. It's just a lot of fun. Good breakout. Good breakout, guys. Way to work. Way to work.
Back at the hospital, Dr. Zelezny's patient Ethan Hansen, the medical student whose shoulder was operated on, comes in for a checkup.
He's back.
Hey.
Hey. What's going on?
How you doing?
Oh, yeah. Are you feeling all right?
Yeah, no problems.
One sec, okay?
Okay.
I've never been in this role before, and it's very different. I think it helps you understand how people feel when they're going in, and it gives you a lot more empathy.
Not feeling any numbness or tingling down your arm or anything like that? Great. Feels good?
Yeah.
Moving your hand all right?
Yeah, no problems.
Thumb? Beautiful. I wonder if I have your pictures in here with me. I'll see in a second.
I'd love to see those.
That's it? That's it and that's it.
Wow.
The one in the back, the little one. I told you we were able to do everything through the scope.
Yeah.
We didn't have to open.
That's nice.
So now, you're only a week out. So we still want some time for this thing to quiet down and heal before we start doing aggressive therapy with it. So I'm going to ask that you... I'll give you a new one. What have you been doing with this thing?
Well, I taped it because it keeps...
Yeah, all right.
It keeps moving on me, so...
I'll give you a new one.
Okay.
We'll give you another one. You stay in that for a couple more weeks, and then we'll start moving you around, first with stuff like this, called Codman's exercises, just to get things loose, and then we'll work on motion, and then strength. Okay? And that'll be it.
Okay. Cool.
Take it easy, Ethan. I'm glad to see you're doing well. If you have any questions, call me.
It's time for Sandra to start her chemotherapy treatment, the final step before her stem cell transplant. She will receive this drip for 24 hours in an attempt to destroy all the cancer cells in her body. Unfortunately, it will also devastate her immune system, leaving her vulnerable to severe illness.
I have a feeling with the chemo that when I start with that, there might be fevers and there might be other side effects with that, but I'll live through it and persevere with the Lord's help.
What I find is, in situations where people are at their worst, they're also at their best many times. And I've met some wonderful people. I ask myself, how can they still believe? And they do, in such horrible situations.
Sandra says she thinks of her blood transfusion as the planting of new seeds in a garden waiting to blossom.
When I have the bone marrow, the stem cell transplant from my twin sister, then it'll be the good seeds going in. But then it'll take time for that to graft and grow and for me to come back. Well, they said about a week and a half after, I'll start feeling a little stronger and the counts will go up.
My sister, she calls me her savior. I think that's a little bit overstated, but you know, it's a really nice thought. And if I feel if I can help in any way to save her, prolong her life, there's not much I wouldn't do. I just love her.
Things towards the lung with a needle. Okay.
Okay.
I don't mean to scare you.
On rounds, Dr. Udelman visits Bert in the ICU, who's recovering from recent heart surgery. He explains to Bert's wife that he must replace a tube that goes to Bert's heart.
We're going to put a wire in this tube, and then I take that tube out, I put in the blue tube, put it in, sew it in. That's it.
Bert must have the tube which monitors his heart replaced every 7 days to minimize the risk of infection.
Okay, so what we're doing is cleaning you off, Bert. I'm going to talk to you every step of the way. This is wet and cold and gross and yucky.
For more information, log on to our website.
Stop being such a difficult patient, Bert. It doesn't help.
Dr. Udelman has gotten very good at distracting his patients to keep them calm.
What'd you do for a living, Bert?
I worked at one time.
You worked at one time? Did you do anything in particular?
No, I did Union Carbide.
Union Carbide. Oh, you were the energy guy.
Yeah.
So what'd you do for Union Carbide?
I did sales engineering.
Sales engineering. What does that mean?
I don't know what the hell it means.
You don't know what it means either, huh? Well, that makes two of us. You make a lot of money?
Hell no.
Oh, man, I tell you. That sounds like a ripoff then.
Tell me about it.
How long have you been retired?
About 18 years.
That's it, huh?
It's a fun job because you work with people every day, and people are absolutely hysterical, very entertaining, very fascinating.
All right, my old friend. Back in business.
Sure is in there.
And they make you work for every inch.
Groovy. I won't be far. Oh, no, I hate these new forms. No, no. Physical assessment of patient. Sick.
Way sick. Very much. The patient is very much sick.
Oh, I don't care.
Don't look at me. Did I make up the form? Ill.
This is the most ridiculous forms.
Well, excuse me, but did you happen to notice your section? Did you happen to notice my section? So don't tell me how ridiculous it is. You are more. Yeah, exactly. That's how I feel.
You are more important. You are more important than I am. That's why you have a bigger section.
Now, they should have given you a little Valium already, did they?
Nurse Joanne Bockham preps Marjorie Sheeran for catheterization before Dr. Munson starts the procedure.
Okay, we'll give you something in the IV. It'll help you relax, and it'll work faster, okay? Most patients come into the lab, and, you know, people are very worried. When you think about your heart, it's a serious, you know, thing, and it's an invasive procedure. Catheter's going to go up to the heart. It's going to take some pictures. The camera's going to move around from side to side. He might ask you to take a deep breath in and hold your breath. Just hold your breath for a few seconds. Breathe if you have to. It's not that important, okay? We try to talk to them and walk them through the whole procedure beforehand. So that way, as things are happening, we can tell them, you know, now we're going to be doing this, now we're going to be doing that, and they know what's next and what to expect. Okay, well, there's one picture that we're going to take. It's going to make you feel really hot all over. It's going to go from your head to your toes, lasts about 30 seconds, just like a hot flash, okay? And we'll tell you before we do the picture. There's no pain, just heat. That's just when we take a picture of your heart muscle, okay?
First, Dr. Munson gives Marjorie some numbing medication. He then puts in a tube that travels up the artery around her heart.
And that's the worst part, okay?
The tiny catheter that's in the artery will inject dye, and they'll take a photograph of the area.
Fine.
Okay, Mrs. Sherry, this is going to be the hot picture coming up now. Jack?
When the harmless dye is released in her aorta, it shows exactly where the narrowing is.
Okay, right here, across the top of the screen, that's the artery you probably had the angioplasty of 10 years ago. See up here how it's pretty narrow in here? It's thick here, gets a little narrow, then it gets thicker again. So right in this area between here, there's a tight blockage there, and it's a little narrow in there too.
We could try and open this up and see if that doesn't improve your symptoms, okay? Because it is a tight narrowing.
Once the diagnosis has been confirmed, Marjorie agrees to have the angioplasty done immediately. The procedure is a success.
She'll have to be in bed for a few hours, and then she'll stay overnight for heart monitoring and so forth, and then tomorrow she can go home and go back to her regular activities, and she shouldn't get any more of that chest pressure because the blockage that was there is fixed now.
I'm going to put a dressing on your leg, okay, and just don't bend that leg for about 3 to 4 hours. Oh, you're welcome. I'm glad it went so well. And these are your pictures to take home, souvenirs, okay?
Before, clogged, after.
Unclogged. Everything went great. Very fortunate to have found it and had it taken care of. I feel good. If it wasn't for this pain, I'd be great. I could get up and go home now.
Dr. Udelman had a strong desire to become a doctor, and he was willing to go through a lot to become one.
I became a doctor because I tried every other field that I thought I liked, and I couldn't do that for the rest of my life, and all that was left was medicine. So kicking and screaming, and studied very, very, very hard. Okay, nobody believes that. But I had a good time. And then I didn't know what I wanted to do, graduated, decided I wanted to be a doctor, but I couldn't get into med school. And then I finally got into grad school in St. Louis, Missouri, as though I hadn't traveled across the world enough. After a year of grad school, got into the med school there and was there for 4 years. And I decided I wanted to be a surgeon and then came back here. And I've been here a year and a half. Hey, it's Ben Udelman. Oh, tell him Ben just breathed a big sigh of relief. Oh, actually, you don't even have to tell him that. Tell him thank you, bye. Oh, my God. After all that, we're not taking the transfer. I cannot believe that happened. I'm actually kind of happy, though. What happened to John? What ultimately happens is that you're just lost and completely confused. And then somehow, one day, you start hanging in there and you start doing things and it makes sense and you don't freak out as much. And it doesn't get easier. You just get used to how hard it is. Ben Udelman, nice to meet you. I tortured your father earlier today.
Something. I had to force feed him. I don't eat again.
The sick part is I really like this job. It sounds ridiculous, but you know, I think a lot of people are afraid to actually say that they like it. I don't know why. It's like there's this culture of complaining that goes on in the hospital. I don't know. I like my job, you know. I enjoy it. I like people. I like taking care of people. That's way too many. I'll give them to my friends. If you can't enjoy it, you're in the wrong place. You're just in the wrong place. You're doing the wrong thing. I like what I do. Good.
We'll get your cells ready. You have to check them again.
It's finally time for Sandra Mount to undergo the critical stem cell transplant using her twin sister's cancer-free blood. The whole process takes only 40 minutes. This is Sandra's last hope.
This is them.
Oh, aren't they yummy? It looks almost like my V8 juice.
It's special V8 juice.
Oh, yeah. So it's sort of hard to be terribly negative if you have a lot of faith. And, you know, the worst that's going to happen is death. And so then you're with God.
You ready? We're going to start.
Well, what it's like to be an identical twin is you just always have somebody you know is close to you. When we were growing up, we were always the same friends, the same places. We shared our homework, we fooled our teachers. As grown-ups, we've remained close. We always kind of understood what the other one said before they completed the sentence, you know, just really very alike in our thoughts and feelings.
Good to the last drop. I always try to get every little bit in there. I try, but sometimes they just stick. That's it. You're done.
Wow.
Empty line. Hey, here we go. Okay. That's it.
This is her daughter, Jennifer.
This is my daughter, Jennifer, my mother.
Since she's gotten this multiple myeloma, we've become closer. Our families, our children, make a point of keeping in touch better. It just brings everybody closer. You know, any kind of stress or crisis makes you much closer.
But this is my little lifesaver here. Gives me her bone, her stem cells, and saves my life. Gives me
What is the rest?
cancer-free blood.
Yes.
Yeah,
So happy to do it, I'll tell you.
and it's so rare to be able to have. Thank you for having twins.
Yeah, you did a good job.